Okay, Talofa and good morning. It's me again. Today is the election day here in the United States and also back home in American Samoa. So it's a very busy day, and I guess it's the testosterone are running high, especially those who are running. In the US, there are about 435 seats in the House, 35 seats in the Senate, and of course the main event, the big prize, the President of the United States, are all in the ballot today. So it's a very important day. And like I say, a lot is at stake. Here in the United States, a lot has been said about this election during the campaign season. And been hearing and listening and reading on different platforms from different candidates. And I must say that this is perhaps the most consequential election in the history of this great experiment called the United States of America. It's the future of the Republic. And as Benjamin Franklin said back in September the 7th, 1787, it's a republic if you can keep it. So good luck, America. We'll see the result later on today or tonight and see if we can keep this republic. A lot has been said. And I must say, it looks like it's a battle between good and evil, democracy and fascism. So I've done my part. I voted a week ago on mailing ballots. So I'm just sitting back and wait. Same in American Samoa. I hope the best team wins. I'm not going to say who I'm rooting for, but I'm just saying that I hope the best team wins, both here in the States and in American Samoa. Anyway, the main purpose of this video, as I mentioned before in my last video, is to let you know of my treatment plan and the medications that I'm going to take. Mind you, I've already started on the medications at the beginning of August. So at this point, it's 3 months already that I've been implementing this plan. And Thursday this week, today is Tuesday and Wednesday, and Thursday I will meet my team, the medical oncologist, and discuss and assess the progress of the medication that I've been taking and see where the cancer is. Anyway, some good news is that last Friday I took a blood test and the result came out. My daughter was able to access the result and came back and shared with me. And the results looks very encouraging and positive. Like my PSA at the beginning was 12.5, and as of that test a couple of days ago, as of Friday last week, it is now 0.16, and the testosterone level is really testosterone, all these terms, has really dropped, which is, according to my daughter, who is also a doctor, it's very positive. He said the less testosterone that you have in your body, especially the one that are involved in the cancer, in the prostate cancer, the better it is. So before we meet with the doctors, I've already got some good news, and my daughter was able to analyze the results. Mind you, she can do that. Okay, but I must tell you about the treatment plan. So the treatment plan, we are beginning. Well, first of all, the doctor said that we must come up with a very aggressive treatment plan because your cancer is very aggressive. It's stage 4, and the prognosis is not good. And I agreed with him. So this is what they came up with. We're going to start with the hormone therapy, or ADT, which stands for androgen deprivation therapy. Its main function is to try and deprive the prostate of receiving testosterone, because the testosterone feeds the cancer in the prostate. So that's the whole purpose, is to slow down the growth of the prostate cancer. So from the results we've already seen, before we discuss it with the other oncologists, sounds very positive. So I'm very happy with it. And so we've already started with the hormone therapy, as I mentioned. This is using hormones to attack the testosterone in the prostate. The next one is radiation, and if needed, the next one will be chemotherapy. And if needed again, we go back to hormone therapy. So there are lots of different medication for the hormone therapy, so they will always be there. But we're beginning with hormone therapy at this point. Well, anyway, we went to see the radiation oncologist, because my daughter and I decided before all this that we should have a very aggressive approach to fighting the cancer. And from what she knows and my own bit of research before we see the oncologist, we came with our own little plan, and that is the hormone therapy and radiation at the same time. But when we went to see the radiation oncologist, she took out the film of the PSMA PET scan that we took in Tacoma, and pointed out to all the areas in the bones that, in addition to the pancreas where the cancer has spread to, and he said, okay, they're all over these parts of your body, but to him at this point it's kind of early to use the radiation to attack the cancer. He said to give the hormone therapy a chance to work out, to fight the cancer, and then we can move into the radiation. He pointed out that there are some dangerous side effects to radiation, but if we have to use it, we'll go into that. So I said to my daughter, I think that sounds, it's from the expert, so we'll go with that. So that's where the radiation stands at this point. And besides, it's also the one that will decide when to go into the chemotherapy. But he said that will be the last resort at this point, because with the chemotherapy, it's going to go through all your body. But the radiation, it's targeted. It will only attack where the cancer is. So that's where we stand as far. That's the treatment plan, more or less. So anyway, like I said, it's almost 3 months now since we started the treatment plan. And how do I feel now? I'm okay. The only problem that I'm having now is my headache. And which is naturally, like they said, headache is one of the side effects of the cancer medication. In addition to that, the sleeplessness. I sleep an average of about 3 to 4 hours a night, and it's not good. I get tired all day. But anyway, something else happened. My old friend, the cluster headache, is something that I've had for years, cluster headache. But then it stopped about 5 years ago, until recently it came back. So we went and saw the doctors, the medical oncologist, and he said, let's stop the medication for now, for 10 days, and we'll see if the cluster headache will go away. We did that, but the cluster headache continued. So we continue anyway. So we continued with the medication, and started using the old treatment that I had done in doing whenever I had an attack of the cluster headache was mainly oxygen, and that has worked. But it looks like this will be with me for a while, because cancer medication is still suspect as the trigger of it. But anyway, there's nothing much we can do about it but to continue with the cancer medication. Okay. The medication that I'm currently taking, it's the Lubron, which is a shot that I take for about 3 months, and then move on to we'll finish that, we'll take it again after 3 months, and then the Elida. Yeah, that's the one. So we take those two at the same time, and like I said, we'll once again evaluate the progress of the cancer and the usefulness of these two medications, and then we'll go on from there. Okay, so basically that's the treatment plan now. We are starting with hormone therapy, then radiation if it's needed, and then chemotherapy. And I did mention the other part of it. We talk about the removing the prostate. I brought it up, and also removing the testicles. But they told me that at this point in my cancer, the chemotherapy will take care of that. No need to remove the prostate at this time, because the only reason why there's a need to remove the prostate is if the cancer has not spread to other parts of your body. But since it's already out there, if we remove the prostate, it's okay, we can do that. But there are side effects, and still the danger that something might happen during the operation, as it is too close to other parts of the body that are vital to my excretion system. So very close to the urethra, so, and also to the testicles. So they say that, for now it's okay. It can be controlled by the hormones, mainly the testosterone, these terms. So that's where, so I said, okay, and what about the testicles? Because that's where the body, that's where the hormones, the testosterone first go to the testicles, and then it goes to the prostate. And they say, okay, that was the old treatment in the past. Whenever somebody has prostate cancer, they cut off the castration, they cut off the testicles. But there are also side effects, and it's no need for that. They say that the shot Lupron will take care of that. Okay, it will stop the testosterone from going to the testicle and then to the prostate. Okay, so that is it. All these things, it's gonna be based. A decision will have to be based on whether the PSA rises again, because if it rises again, we'll change the medication and move on to something else. It sounds, according to the doctors, they have a lot of answers to the cancers, But mind you, the cancer cannot be cured at this stage. Okay? They say that if it was detected earlier, they could have just treated it, removed the prostate there, and that's it. That's the end of the prostate cancer. But since it's too late, we won't do that. So that's where we are as far as treatment and the plan is concerned. So let's hope that in our meeting on Thursday, something more positive comes out according to the doctors. But I'm not that worried now. Now I understand the whole plan and the medications, and they told me there are lots of different medications that we can try out. But they emphasize cancer cannot be cured at this point in the stage of your cancer, but they can be treated to slow down the cancer. Okay, so people, friends and families, that's where we are. Yeah. Whaftaia ile au mata fo i o lo whalonglongo mai nei pokalama nei videos o le tūranga le waiai ia wa amata ia treatment o toina ai roso soro leia fia fo i fo mai ma lato whai o whai peisi luna o matu tanuanga ia ma sio fo ta mai manga i wha mai ma waila au o le awha o ngā ma o lo whai o le mea lau te whiwhia e tele ia treatment se whai a le work lesi ia me ia tu lesi o le mea lana nao pe ua whaai ti ai fo i marangona ai fo le nganga whiwhia i le whaasoa mai e fo mai i le tūlanga o le uiai ai o le me moni lava ia o le tūlanga le uiai la cancer stage 4 e le tu whai kiwa o le ufaso solo a waila au o lo sa mia i tamata i fo mai ia tau fiofia i le spirit al tamale o le whaia si whaita si a uo lea ai le ai o te whatuatua lava i fo mai ia e maise le musmusunga le ngapa ia o lo whapea o na o mai e so umai le amno pe o le whaifia tu mau ia ai talo foi e so soni e lita mai ta i mola te tongitinga ia nea mai ia o le tūranga na o iai la vale o sa i mai whatu tua e te mai langi na te whasoso mai o tatu malosi ai es whamtalanga le nā ai e tau sia lang pautanga le neiasa ia hi manuia o ni iai ni whalavlavi tupu mai ia o le whai unga le nā o le ni video le ni tuasu ia tu whama i nuia